Here's a patient, 73-year-old white male with congestive heart failure, CHF, chronic kidney disease, CKD, diabetes mellitus, DM, an EF or ejection fraction of 25%. He was full of fluid, edema in his legs, was basically on death's door. They put a left ventricular assist device in him, which is basically a pump outside the heart with two tubes, one that goes from the left ventricle to the aorta. When you listen to the heart, there's a and in some people they don't even have a heartbeat, so there's no lub-dub. It's just a but he had a lub-dub, that kind of thing. Pretty sick guy, and no one's going to touch him. He can't even get a heart transplant because he weighs too much. So what happens? He gets sent to me. So we put him on the low-carb, high-fat diet or a keto diet. We include a sodium restriction, a water restriction, and a vitamin K restriction because he's taken warfarin or Coumadin, which is an anticoagulant. It's okay. You just monitor these things, and you don't get so afraid that you can't do something. You just monitor these things a little more. So this is a little more intensive. They're home daily weights, which he already knew. He's home monitoring his PTINR, which is the blood thinner. Over a year, he lost 44 pounds from 313 to 269. His exercise tolerance has improved. His insulin requirement decreased from 100 units a day to 45 units a day. People ask, oh, but your kidneys, what about the kidneys? His creatinine, a measure of kidney function, improved from 1.8 to 1.5. The lower the better in terms of the creatinine. And his most recent left ventricular ejection fraction is 40%. He came back just a few weeks ago, one reason I brought this here, and he said, you know, Doc, they're thinking about an explant program, the starting one. And what they're going to do is they're going to put me in the hospital, and they're going to turn off the pump and see how I do. And then they might even take out the LVAD, the heart assist device. Wow. So we now have about a dozen folks with LVADs. Some we've sent on to heart transplant. Some who are feeling so well, they're thinking about just leaving the LVAD in and not doing the transplant, because the transplant is no cakewalk. I mean, it's a big deal. You're on anti-rejection meds afterwards and all. But so there's even consideration now of the LVAD being removed. Essentially, this would have been, if this all goes according to plan, and he does great, that basically his heart failure, which was, he's on death's door, he got abridged to get on the low-carb diet, which is this ventricular device. He's lost weight, and maybe the low carbs, the ketones, we don't know, help things, and what a save, huh? You know?